everybody. We're here live at the Pink Signature Salon and Spa in South Carolina. And this is Shanita, the manager of the place here. And she just finished taking the anterior structural balancing class, and she's going to tell you a little bit about it. So Shanita, what would you like to tell massage therapists out there about the class?
The class was very informative. I felt like it touched on a lot of stuff that I learned in school. And it reminded me of ways that I could definitely help my clients. Also, it just makes me feel good today. Like, I really feel opened up. I mean, especially like with some of the work that we did with the lumbar and, different things like that. But mainly, it just really helped me feel more secure in my practice and my work, the skill that I know that I have, and just kind of enhanced it, as well as just made me a better therapist.
Well, great. Thank you for taking the class and for sharing with the massage therapists across the world what this class did for you. And we hope to see you at Interior Structural Balancing. Thank you. Let's join Elan Schacter, licensed massage therapist and instructor of Interior Structural Balancing. Today we're going to show you just a few of the clips from our class where he addresses the Quadratus Lumborum. Hope you enjoy the presentation.
So we're coming in from the side. Now what we're feeling for is a muscle that runs from the 12th rib to the iliac crest. Now if you look at a skeleton model or a picture in a book, you're going to see this huge space where the thoracolumbar aponeurosis covers here and the rectus abdominis is in front, and this huge space between the 12th rib and the iliac crest. But in reality, it's a very small space. We don't have a great amount of area to work in. Now, the actual action of the Quadratus Lumborum is hip hiking, which is elevating your hip like that. To make sure that you are on this muscle, to palpate this muscle, you're going to ask your client, gently act as if you're trying to bring your hip towards your ear. Okay, and relax. Now, if you're on the Quadratus Lumborum, you should feel yourself on a muscle that contracts when she does that. Now I've got my fingers in here, I'm getting deeper, I'm moving a little bit more anteriorly because that's where I felt her QL was, okay? If you could contract again please, lifting your hip, and there we go. We are on the Quadratus Lumborum, you can relax. And with this client, I don't have that much room to spread here. I don't have the ability to really get space between this iliac crest and 12th rib, so I'm going to have to create that space. And I'm going to do that by getting a little bit creative. Okay, what I'm going to do is bring her drape over her like this, and it's going to be a little bit wrinkly, but we want to make sure that we have the area that we're treating undraped here. Now I'm going to ask her to, now instead of holding the pillow that she has in front of her, I want her to hand me the pillow from the front to make sure that the draping stays tidy. My fingers are still on her QL. I want you to scootsy daisy upwards. I'm going to slide this under your hip. Okay. And I want you to take your upper hand, in this case your left hand, and I want you to reach behind you, grabbing the back side of the table. This has just created a lot more space for me to treat here between her 12th rib and her iliac crest. I now have her in a diagonal position with her left thigh flexed and her right arm reaching behind her. So she is kind of like that. So she's reaching behind her with her upper arm and her lower leg. She's reaching anteriorly. So now I have more space here to get to this Quadratus Lumborum. Now I can feel it's nice and tight, it's stretched out. And from here, I'm just going to start with a simple compression. I don't need to use fingertips. I can use knuckles. I can use my elbow. I could use anything, any funky massage tool that you've purchased at the store. Make sure you're keeping good contact with your client though. So on a scale of 1 through 3 there. This is a 2, perfect. Here's a little side trick for you. I'm feeling my nose is itchy. Happens to us all the time. Never scratch your nose in a massage treatment. You can cross-contaminate unless you're washing your nose between every treatment. Take your shirt, scratch with that instead. And we're waiting for a release. And remember, this is just the first position. It's as different in people as noses are different in people. And you don't want to poke too hard at that pokey portion of the 12th rib, at that point of the 12th rib, which doesn't attach to the sternum anteriorly. It just has a floating edge that sticks out. And it's probably about that long. It's not a big rib. But it has some important muscle attachments to it, namely the Quadratus Lumborum, which we're treating right now. Okay, so after we use many of our techniques, and we could use some great ones here, we can do a shear like this, spreading over that tissue. We can also do a cross-hand shear, making space in this area like that. We can do some effleurage and petrissage, kneading, compressions, frictions, stripping if you have enough space. Many of the techniques we like to use, depending on why you're here, you might use different strokes. So we're working the Quadratus Lumborum, and something that I'm going to recommend when you're working in an area as sensitive as this and you want as much focus as you possibly can, you have to not do exactly what I'm doing right now, which is talking. Your mind does not have full focus on what's going on in your hands and your client's body if you're coming up with words and talking. You may be a great multitasker, but you're going to have better focus just monotasking for these moments that you are in sensitive areas like the Quadratus Lumborum, where you really want to make sure that what your fingertips are feeling is guiding your mind and guiding your hands. I want to make a note here about taking your time when accessing these deep tissues. You may ask yourself, or want to ask me, well, how long would you spend treating the Quadratus Lumborum? And I guess the answer would be as much as you need to. Depending on the focus of your treatment, you might spend a few moments just glossing over it without actually reaching full depth and getting an effective amount of releases. But if the focus of your treatment is going to be releasing tension of the Quadratus Lumborum, you're going to take your time and spend more time here. Now, this might mean that to get a whole body effect, to get all of the points that you want to treat along your client, if you want to do that, you're going to have to set them up with a series of treatments. And you want to explain this before you start. It's called informed consent. You want to discuss your plan with your client and have them agree to it. Once you have them agree that you're going to start with the rectus abdominis, the Quadratus Lumborum, maybe iliopsoas, and then work your way up next week to the pecs or the cervical region or maybe the hips, you're going to find that you have more privilege to spend time in a certain area, and you don't have to get everything in 1 hour. You're going to find that taking your time and seeing them next week and hitting the next spot might be fantastically effective for you.
If you'd like to host a class in your area, contact me, Gloria, at massageproce@gmail.com. Thank you for joining us. Have a great day.